One of the main unmet needs is our ability to try to diagnose psoriatic arthritis as early as possible. And the reason why we want to diagnose it early is because it's in early disease that patients have no evidence of joint damage, no disability, no deformity. So if we can treat them early, we can therefore get them back to a normal living again. So it's very important to make that early diagnosis. Making the early diagnosis, however, is difficult. For example, in Dublin, where we have a study ongoing of patients with psoriasis who are following longitudinally over years to look to see what happens to them in terms of the development of arthritis, we find that many of those patients, it's quite difficult to be sure whether they have or they haven't. At one end of the spectrum, you have patients who have psoriasis, who have no signs, no symptoms of any musculoskeletal disease. And then on the other side, you've got patients who clearly have developed psoriatic arthritis. But in between, you've got a bunch of patients who have some symptoms, sometimes some signs, but insufficient for us to say for definite that this is psoriatic arthritis. So it's complex, and we need a better way of being able to select out from that middle group, those who will definitely go on to psoriatic arthritis. And that's the focus of our research and indeed of a number of groups that are looking at this area. So we're hopeful that if we can collect together very good clinical information, good radiograph or X-ray information, together with information relating to the genetics and information relating to the proteins that those patients are expressing, that we may be able to develop some sort of better system for picking out those patients likely to progress.